Okay. I want to thank everyone who's joined us and anybody who's watching this on Facebook Live. My name is Dr. Michael Fernandez. I'm a physical therapist with Kinetic Physical Therapy. And today what we're talking about is a little bit about the coronavirus pandemic, where we stand, what's coming, and how we can stay active in order to help protect ourselves in the new year. So I want to wish everyone a happy new year. I hope everyone had a safe and happy and healthy holiday. So I'm going to breeze through some things early on. Some of you, or most of you, may be pretty familiar with some of the stuff that we're going to look at here. But I think it's important to just reiterate and take a look at what's going on statistically across the country as far as the COVID cases go. This chart right here that you see in front of you is the current statistics and trends up as of January 4th. This is the number of average daily positive test cases. So you can see even when we spiked early in March, April, May, that we were at about maybe 30 to 40,000 cases per day. During this most recent spike in the fall, we've seen an uptick, and now we're upwards of over 200,000 cases on average per day. Some of this can be attributed to more group gatherings, perhaps COVID fatigue, where maybe we're being a little bit less diligent about our mask wearing and our social distancing, family events, and other group settings. Now, if we take a little bit of a closer look, here's the trends that we're seeing in the in the state of Pennsylvania. You'll see the same uptick, particularly in October and November. Lately, over the past few weeks, we've seen a little bit of a downturn, which is a positive for us, right? We're seeing a little bit of a decrease in those daily confirmed positives. Hopefully, we can continue on that trend. We'll have to see what happens in the next few weeks as the incubation period of the virus following the holidays occurs, and we see where we're at in the next couple of weeks. If we also want to look a little bit more precisely at Chester County, as I imagine most of us are in the Chester County area, this is on Chester County's website, and at the end I'm going to give you the link to that so you can track this and look at some other good statistics county-wise. This shows not just the daily positives, but the total tests taken. So the green bars there represent the total daily tests taken. The blue bars there represent the daily positive. So again, it follows that same trend, although we've kind of been pretty steady through most of December. So hopefully we can see either stay steady or see a decline in that over the next weeks and months. Most of us by now should be pretty familiar with the CDC guidelines. One thing I'm just going to point out, though, the 6 feet rules from others who don't live with you, the masks don't replace this. So just wearing a mask is one of the most important things we can do, but staying 6 feet away from each other is important, even if we are still wearing a mask. Just because you wear a mask doesn't mean you should automatically assume that it's safe to be within 6 feet of somebody. But again, just to reiterate, wearing the masks, staying at least 6 feet apart from people, and avoiding crowds. The more people you're in contact with, certainly the more likely you are to be exposed to COVID-19. If you're unsure and you think you might have been coming in contact, then it's appropriate to be tested. You should be tested if you have symptoms of COVID-19. So, by now we're probably all familiar with those, whether it's a cough, sore throat, runny nose, difficulty breathing, cold, body aches, fatigue, those type of things. You might want to contact your physician and maybe set up to get a test. Those who have had close contact, meaning within 6 feet of somebody for a total of 15 minutes or more, who has a confirmed COVID-19 diagnosis, people who've been in activities that put them at higher risk because they can't socially distance during travel, attending large social or mass gatherings, being in crowded indoor settings. If you've also, there's some people who maybe have been asked or referred to get testing by their healthcare provider for other reasons, certainly would want to get testing. The thing I want to highlight here is anybody who is awaiting test results should assume and act like you're contagious and that you have a positive test, and you should self-quarantine until you are receive confirmation that your test was negative. What you don't want to do is assume that you're negative and actually be positive and then go spread that to other people. Unfortunately, there's been some instances of people doing that, and we need to actually be cautious about this and assume that we're positive until it's confirmed that we're not. I'm not going to go through all the PA guidelines. One of the things I want to highlight here is we certainly had some more increased restrictions over the December holiday season, but currently most indoor businesses can operate with a 75% occupancy. Some of the exceptions would be your bars and restaurants, which are limited to still 50% capacity for indoor dining. Even though a lot of people are still wearing masks, the question comes up, how effective are the masks? The research at this point just is overwhelmingly in favor of wearing masks. And the question is, why do they work? A lot of times the question is, well, I can still feel myself breathing through the mask. I can still feel the air getting through. It's probably not trapping anything, so why should I wear it? The fact is that the virus itself is smaller than the pores in the mask. However, the virus has to be transported on droplets. Those droplets typically are not going to be smaller than the pores in the mask that's covering your face. That allows these droplets to be trapped in the mask, which would prevent it from spreading to somebody else. Certainly, if you have the ability, multiple layers are better than a single layer. And again, wearing a mask does not substitute for 6-foot social distancing. There's also a benefit to wearing a mask and protecting yourself. It can reduce the viral load that you receive if you are in contact with somebody with the virus. So don't dismiss it as a protective mechanism, even though it's not as effective as if the person who's sick was wearing the mask. And I love the chart on the left of the screen here, which really highlights this, that certainly if nobody's wearing a mask, the risk of spread is much higher. If both people are wearing a mask, the risk of spread from the carrier of COVID-19 to the non-carrier is actually very, very low. So it's important to appreciate that if we all do our part, we can significantly reduce our risk of being exposed to and actually getting sick from COVID-19. So you can see here by this chart that it just highlights the benefit of wearing the masks more in a visual form. Obviously, right now, the big news is with the vaccines, and are they effective? I think that most of us probably are aware that the research has kind of shown that they're effective. And I think it's important to highlight that anything over 70% or so is what the scientists were hoping for. And the Moderna and Pfizer vaccine have been shown to be 94% effective at preventing symptomatic COVID-19. Those who did end up contracting COVID-19, who had received the vaccine, tended to have significantly more mild symptoms. And they did not end up having severe illness as a result of it. So even if it didn't prevent them from getting the virus, it still significantly reduces the risk of them getting a severe illness. The AstraZeneca vaccine, which is on the horizon, it's not anticipated to be approved in the United States until April. It is being released elsewhere, but that's shown to be about 70% effective at this time. Again, we should anticipate that coming to market in about April. Certainly there's fear out there, understandably, about the mutations that we're hearing about that are maybe more easily transmitted, or there's fear of whether or not these mutations are going to prevent the vaccines from working. The reality is that viruses tend to mutate and evolve over time. This is a survival mechanism in order for that virus to continue to spread and survive until it can latch on to its host, being us as humans. Also, the health officials and scientists believe that the vaccine should provide protection against most of the current mutations, especially looking more at the UK strain that we are hearing about. While that strain is being shown to be a little bit more easily transmitted, the thought and the idea yet, while the research still has to be done, belief is that it should still protect against that mutation. The other one of major concern is the mutation that is being seen in South Africa. That is the one that is maybe a little bit more concerning because of where the mutation is occurring in the virus. In time, research is going to show us what effect the vaccine has on that mutation. However, there is some belief within science circles that the vaccines should still provide some level of protection, even if it's not that same 94% efficacy of the more original mutation in forms of the coronavirus. The other thing is, now that the vaccines have been developed, it's a lot easier for scientists to adjust and adapt the vaccine to these mutations versus developing a whole new vaccine. So the same process is unlikely to have to take place where it takes a year and a half in order to develop a vaccine to that mutation. The development period really should be much more reduced. Sometimes, in some magnitudes, even down to maybe taking, weeks to maybe a month or two in order to develop that vaccine for new strains. Now, that doesn't mean that there might not be a future mutation that might be more worrisome, but I think it's important to put everything in context and not lose hope at this point that we are still on the right track. The next thing is, are the vaccines safe? So all vaccines undergo large-scale clinical trials before they're released to the public. The Moderna and Pfizer vaccines have undergone phase 3 trials. At each phase 1, 2, and 3, the number of participants is increased significantly. At phase 3, usually you're seeing upwards of 30,000 or more participants in the study. Half of them are giving a placebo, and half of them are receiving the actual vaccine that's being studied. In this study, about 15,000 people were receiving the active vaccine, and there were very mild side effects. And in a lot of the cases, those side effects are indicating that the vaccine is probably working because it's causing an immune response. So it's important to appreciate that before you go in, that you may have some mild symptoms, but that's a sign that the vaccine is working and likely going to protect you when you're exposed to the actual virus. Severe reactions were extremely rare, and anytime that these severe reactions occur, they are each individually assessed to determine whether it may have been an effect of the vaccine or if there were some other factors in there. These vaccines have undergone a lot of testing and been deemed safe for release to the public. Certainly, I'm not here to tell you to take the vaccine or not, but I think it's important to appreciate, with all the information out there, that there's a lot of misleading information out there. But the reality is that on the whole, the big picture is that all the data and the research we have now indicates that the vaccine is both safe, effective, as well as safe for us to take. One of the questions is whether or not the vaccine is going to prevent us from actually spreading coronavirus to others. It's not crystal clear yet, but the belief is that yes, the vaccine should prevent us from spreading the virus. However, until we know for certain, we should still be wearing masks and maintaining 6-foot social distancing. Don't assume because you have the vaccine that you can't possibly transmit it to somebody else until we learn more and we're told that it's safe for us to go around without masks if we've been vaccinated. So a lot of people also are curious, when and where and how do I get vaccinated? Right now, Chester County is following a more large-scale national guidelines as far as a phased rollout. And the way this is going to work is that there's phase 1 and 2. There's 3 parts to phase 1. As supply is available, that supply will be made available generally on a first-come, first-served basis. In Chester County, those who are eligible will have access to a website where they can go sign up for an appointment. In phase 1A, This will include frontline medical providers, healthcare personnel, long-term care residents, as well as coroners, medical examiners, and funeral staff. And for anybody who wants this information, this is on Chester County's website, and I will have a link to that at the end so you can keep track of the updates if there are any changes or modifications to this over time. In phase B, I'm not going to go through all these, but generally it's going to be your teachers, your childcare staff, firefighters. The one I want to highlight is persons 75 years or older. So if you are or know somebody who is 75 years or older, when we get to phase 1B, you will have the ability to schedule your vaccination if you wish to get one. Phase C is going to include more of your higher risk individuals who may be in other industries, but also coming in contact with people more frequently. And then your next high risk group as far as age, your 65 to 74-year-olds will be in this phase 1C. Then once all phase 1A, A, B, and C are completed, then the rollout will go to phase 2. At phase 2, this will include anybody who wasn't already included in any of the other phases. Generally, most of the studies have been done with persons 16 years and older. So certainly if you have somebody who's less than that, then certainly I would consult with your physician or doctor before just, making that decision for yourself. So what else can you do to further protect yourself and your family? What you can do is exercise. And the reality is that physical activity is shown to actually boost our immune system. And the research shows that we have a 30% reduction in risk of acquiring an infectious disease if we exercise, if we regularly participate in moderate to vigorous exercise on a regular basis. And even more important is that it results in a reduction of our mortality rate by up to 37%. Now, this isn't specifically related to COVID-19 or the coronavirus, so I don't want to make that statement. But in general, COVID-19 is an infectious disease which affects the immune system. It stands to reason that the more we can exercise and boost our immune system, the better we should be able to respond if we do come in contact. One study that the University of Virginia Medical School, the University of Virginia School of Medicine looked at, which was really interesting. Now, this was done more early in kind of the fall, summertime. But what they did is they were looking at the rate of ICU admissions. And what it said, what the data showed is that up to 80% of individuals that were in the ICU for coronavirus suffered from something called acute respiratory distress syndrome, or ARDS for short. What we know is that cardiovascular exercise can release antioxidants that reduce or prevent the onset of ARDS. Now, this study is not saying that exercise is going to prevent you from getting the coronavirus and passing. What it's suggesting is that if ARDS is a contributing factor to the mortality of individuals with severe COVID-19 illness, it stands to reason that, again, exercise helping boosting the immune system and releasing those antioxidants may provide some type of defense mechanism from severe illness and potentially reduce your risk of mortality if you do get severely sick. So what are the guidelines for exercise? I think it's important to understand what moderate and vigorous activity is if we're going to try to participate in it. So for an adult, 150 minutes of moderate intensity aerobic activity per week is recommended, 75 minutes or more of vigorous intensity physical activity. And for children and adolescents, the recommendation is to be active for at least 60 minutes every day. Moderate intensity activity generally includes things like mowing your lawn, going for a leisurely bike ride, or a brisk walk in the park. More vigorous activities would include a more intense hike, a more of a road cycling or more aggressive bike ride, and jogging or running, things where you're getting your heart rate up. You're probably not going to be talking to your neighbor or having a good conversation with your partner while you're doing these activities. If you are, then you're not in that, you're certainly not going to be in that vigorous activity category. So what do you do if you're stuck at home? It's cold, there's snow on the ground, there's ice on the road, maybe there's issues with access to a safe place to exercise outside, and they're certainly concerned with getting access to the gym right now because you're nervous about being around a crowd or who else might be there, and trying to protect yourself from the coronavirus. I think it's understandable that you might have some concerns. That's for each individual to make, whether they feel safe going to these businesses or not. But it's important to also find ways to work out at home and stay active in the meantime, so that again we can keep our immune system as healthy as possible in the event that we are exposed. So we're going to actually talk about these and demonstrate a lot more in detail next week. Different exercises, particularly cardiovascular exercises you can do at home. The one on the left here is a step up exercise. If you have steps at home, you could do this on the first step, or if you have a stool, you could do this with a stool. And basically you're just going to step up and down on that stool at a brisk pace to get your heart rate up and your cardio and your respiratory rate up. The person in the middle is doing jumping jacks, things like some plyometric, Tybo. I don't know if you've got some old Tybo VHSs at home and you got the VHS player set up. Pop those bad boys in and maybe you can do some cardiovascular exercise that way. Now, again, if you're concerned about starting an exercise program because maybe you haven't done one recently, I would recommend consulting with your physician or a physical therapist before initiating an exercise program if you haven't been exercising recently. But we're also going to, again, next week, do a little bit more demonstration. So next week, we're going to do a full session just on the different type of cardiovascular exercises you can do at home without having to go out to the gym or leave your house. So what you can do is check our website out. You can visit kineticptpa.com. The updates will actually be on our Facebook page. So if you go to facebook.com and look up Kinetic, the date and time for that webinar and Facebook Live will be posted on there. It will likely be about the same time next week on Thursday at about 5 o'clock in the evening. But that may change. So check out our Facebook page to keep tabs on that. I also promised some resources at the end. These are some reliable resources and valuable resources for you to keep track of the information as it comes in and it's changing. The CDC is a great resource for accurate and up-to-date information. Their coronavirus link in particular, cdc.gov/coronavirus, has all the information you could want from them. If you're looking for Chester County information in particular, looking at numbers, looking at where to get and how to get tested, if you want to look at those phases and find out which phase you fall into when it comes to access to the vaccine, that's also on the Chester County's website. Again, listed here, chesco.org 4376/coronavirus-COVID-19. The World Health Organization also has some great information on what's going on at more of a larger scale, and a great source of accurate and reliable information as well. So please feel free to check those links out as you wish. So I'm going to wrap up here, and this video and link will stay on our Facebook page for a little while. It's also going to go on our YouTube page. So if you go to YouTube and search for Kinetic TV, you'll be able to view this video. It should be up by the end of the weekend. And then next week, again, we're going to go through and demonstrate some exercises you can do in the safety of your own home in order to stay active and exercise while limiting your exposure outside of the house. Some other social media you can keep track of is our our Facebook page, Kinetic Physical Therapy. And that's where we'll post updates to any future webinars. And then one other quick note about the YouTube page. We have a lot of other great content on there, ranging from back pain to nutrition to sleep. So please check that out. And if you have any questions, please feel free to contact me directly. I'm happy to answer any questions you have. You can contact me. My email is at the bottom of the page here. It's mikeF@kineticptpa.com. So I appreciate everybody joining us, and I look forward to seeing you guys next week. And next week we'll get to working out. Take care, everybody. Have a great day.